Hello, my name is Anna Noonan, and I will be performing my head-to-toe assessment on Mr. Smith. Mr. Smith, do I have your consent for evaluation purposes to submit this video to my teacher, as well as to do your head-to-toe assessment today?
Yes.
Okay, thank you. I'm going to close this door to provide privacy throughout the exam and also wash my hands. Here. Okay, when looking at Mr. Smith, I can see that he's sitting comfortably in his chair, and he seems well dressed for this exam, and his hair seems to be brushed, and there's no obvious signs of trauma on him, and he seems very relaxed. I will now be assessing his skin. His skin color seems to be consistent with his ethnocultural heritage. I'll use the back of my hand to assess his skin temperature, and he's warm and dry to the touch, and I will also be performing a skin trigger test, and it is rebounding very promptly. I will also be doing this on the extremities, and his lower extremities are also warm and dry to the touch, and his skin rebounds quickly also. I will now be assessing his eyes. When looking at Mr. Smith's eyes, I will be doing the Hirschberg's test, which is the corneal light reflex test. I'm looking for symmetrical light in the pupils of his eyes, and its parallel alignment of the eye axis is when I'm shining this light. His conjunctiva appears to be clear, his sclera seems to be white, and the cornea is smooth. His pupils are equal, round, and reactive to light, and they seem to be accommodating. The next test that I will be performing is the 6 cardinal points of gaze. This is the diagnostic test to assess cranial nerve 3, 4, and 6. Cranial nerve 3 is the ocular motor nerve. Cranial nerve 4 is the trochlear nerve, and cranial nerve 6 is the abducens nerve. To do so, I'll ask Mr. Smith to follow my pen light, keeping his head still in the 6 positions of gaze. Okay, and he has passed this test. The next test that I will be performing is a confrontation test. I'll ask Mr. Smith to hold this object in front of his eye, and I will get on his level and ask him to tell me when he sees my finger in his peripherals.
No. 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 No.
Perfect. He has passed this test. The next test that we will be performing is using the Snellen chart. We will be assessing cranial nerve 2, which is the optic nerve, and I'll have Mr. Smith stand 20 feet away and see what the lowest line he's able to read.
D-E-F-P-O-T-E-C.
Perfect. So Mr. Smith was able to read 20 feet away theoretically, what a normal eye can see at 20 feet away. Okay. Now I will be assessing Mr. Smith's ears. I can see that his ears are symmetrical and that they are on both sides. There's no redness, no swelling, no thickening noted at all, and there appears to be no pain on his ears. I will be assessing cranial nerve 8, which is the acoustic nerve, and to do so I will be whispering in his ear while I'm asking him on the opposite ear to be pressing in and out on his tragus. I will say a 2-syllable word, whispering, and I will start by expiring before.
Sunday.
Baseball.
Baseball.
Perfect. And he was able to repeat that back to me. I will do this on the other side.
Hockey. Monday.
And he was also able to repeat that back to me. I am now going to assess cranial nerve 7, which is the facial nerve. And to do so, I'm going to ask Mr. Smith to smile and also to raise his eyebrows and frown. I'm looking for that it's symmetrical, and he's able to do so. And his smile is also equal. To check his cerebellar function, I will ask Mr. Smith to do rapid alternating movements, putting his hands on his thighs and moving back and forth, and he's able to do so. Another way that we can assess this is by him touching his thumb to pointer, thumb to middle, thumb to ring, and thumb to pinky, and then going in reverse and doing that quickly. Another way we can also assess is having him touch his nose touch my finger. Very good. And he was also able to do this. I will be now assessing his sensory function. To do so, I will be using a dull edge and a sharp edge, and I will be checking it on his face, arms, and legs at different intervals so he's not able to distinguish or able to memorize what I would be doing. I'm going to ask him to shut his eyes.
Soft. Sharp. Sharp. Soft.
Very good.
Sharp. Sharp.
Okay. The next thing that we will be assessing are the deep tendon reflexes. These are graded on a scale of 0 to 4+. The first reflex that we will be assessing is the brachial radialis, which is located right here. Very good, and that would be graded 2+. The next one that we will be assessing is his bicep. Finding that tendon and striking my thumb. Very good. Reflex of 2+. The next one we will be assessing is the tricep. Finding that tendon, letting his arm go limp. Very good. And the last one, I will ask him to sit up on the chair because you would like them to be dangling. So 2+ was for all of those. And the patellar, we're gonna look right here. That is also graded 2+. And then the last one is the Achilles. And I'm gonna dorsiflex his foot. Very good. And I would also note that one as being 2+. Mr. Smith, you can sit back in your chair. Now I will be doing an inspection of his chest. Upon looking at Mr. Smith's chest, you can see the coastal angle is within 90 degrees. His ribs are sloping downwards. There's no use of accessory muscles. When looking behind, right here, you can see that his spine is in the middle, right here, and he's breathing normally. If he was having trouble breathing, he would most likely be seen in the tripod position, and the use of accessory muscles would be noted. In terms of anatomy of the lungs, there's the right upper lobe, the right middle lobe, and the right lower lobe, and there's also the left upper lobe and the left lower lobe. So I will be listening, auscultating Mr. Smith's breath sounds. Also, one thing to note is bronchial sounds will only be noted near the trachea and larynx. However, vesicular breath sounds will be heard throughout the lung field. So I will begin. I'll ask him to breathe in and out. Right upper lobe, vesicular breath sounds. Left upper lobe, vesicular breath sounds. Left upper lobe, vesicular breath sounds. Right upper lobe, vesicular breath sounds. Right upper lobe, vesicular breath sounds. Left upper lobe, vesicular breath sounds. Left upper lobe, vesicular breath sounds. Right middle lobe, vesicular breath sounds. Right lower lobe, vesicular breath sounds. Left lower lobe, vesicular breath sounds. Left lower lobe, vesicular breath sounds. And right lower lobe, vesicular breath sounds. Okay, I will now be auscultating the posterior as well. I will be avoiding his scapula and also his spine. And as well, I should be hearing vesicular breath sounds throughout, unless I'm over the trachea. So, left upper lobe vesicular breath sounds. Right upper lobe vesicular breath sounds. Right upper lobe vesicular breath sounds. Left upper lobe vesicular breath sounds. Left upper lobe vesicular breath sounds. Right upper lobe vesicular breath sounds. Right lower lobe vesicular breath sounds. left lower lobe vesicular breath sounds, left lower lobe vesicular breath sounds, right lower lobe vesicular breath sounds, right lower lobe vesicular breath sounds, left lower lobe vesicular breath sounds. Okay, the next thing that I will be assessing is the cardiovascular and peripheral vascular system. I will be assessing for edema, so I will be assessing his skin. Pitting edema would be if my marks of my fingers were left in his skin. There seems to be none on his wrists, and I will also be assessing this on his feet right here, and there seems to be no edema. I'm also going to be doing a cap refill, and I'm able to see that it blanches immediately, and I will also check on his lower extremity on his toe right there. The next thing that I will be assessing are his pulses. So the first pulse that I will assess is the radial pulse right here. I will be assessing this for 30 seconds, and I will multiply it by 2 if the pulse is regular, and which it seems to be. Pulses are graded on 0 to 3, and his is 2+ right here. The next pulse that I will be assessing is the popliteal pulse, which is found behind the knee. There's a diamond-shaped fossa right here. It's a little deeper, so it's harder to find, but I was able to find it. Right there. Also the posterior tibial, which is just inside of the ankle. And then the dorsalis pedis, you're looking for the big toe and moving up right here, and this is where you will be finding it. Okay, I will now be listening to or auscultating the 5 osculatory points of the heart. So the first osculatory area is second intercostal space, and this is the aortic valve, and it's right of the sternum. The second one is the pulmonic, which is left of the sternum, second intercostal space. The third is Erb's point, left of the sternum. The fourth is the tricuspid, which is 4th to 5th, left of the sternum. 4th to 5th intercostal space, left of the sternum. And then the mitral valve is located mid-clavicular line, 5th intercostal space. At this point, I would listen for an entire minute, as this is point of maximal impulse. The rate and rhythm seems to be regular, and S1 is louder than S2. Okay, Mr. Smith, so the following thing that I will be doing is doing an abdomen assessment. So I'll ask you to put your chair back right here, and if you come a little closer, you'll be able to see. So I will be inspecting his abdomen. Both sides seem to be symmetrical. His skin seems to be consistent with its ethnocultural heritage. There's no lumps, bumps, bruising, no scarring that is obvious, and the contour of his stomach appears to be flat. I will now be auscultating his abdomen before I palpate or percuss, because I don't want to induce any bowel sounds, and I also will be starting in the right lower quadrant and making my way around clockwise to the right upper quadrant, left upper quadrant, then left lower quadrant. Bowel sounds noted in the right lower quadrant. Bowel sounds noted in the right upper quadrant. Bowel sounds noted in the left upper quadrant. Bowel sounds noted in the left lower quadrant. Okay, I will now be percussing. I will be using the same format that I did my auscultation, and I will be okay. In terms of sounds that I would hear, dullness would be noted over the liver and the spleen. The liver is in the right upper quadrant and the spleen is in the left upper quadrant. I would hear flat over a bone or tumor or muscle, and I would also hear tympany over the intestines, as there can be air in the intestines. Okay, now I will perform my palpation on Mr. Smith. Again, going in the same rotation. I am palpating. I'm assessing for any lumps, nodules, discomfort, any guarding, any pain that would be noted throughout, and he seems to be okay right there. Okay, Mr. Smith, I'm now going to ask you to stand up, and I'm going to assess your gait one more time. I'm just going to get you to walk back and forth right here, and if you can come back. Okay, you can sit down. I'm just going to assess your wrists for any swelling, any pain, any deformities. I will be checking your knees for any pain, deformities, heat, redness, and also your ankles for any heat, deformity, or pain. Okay, now I will be grading your muscle strength. This is graded on a scale of 0 to 5. I will be assessing your wrist strength first, and I'm going to apply pressure, and please put pressure against my hand. I would grade this one a 5+. For your arm, I will have you push against mine. Again, that would be graded a 5+. And for your legs, I will have you apply pressure, and that also would be graded a 5+. Okay, Mr. Smith, if you could just stand up now. We're going to check your range of motions and degrees of your spine. The first one will be flexion, which will be touching your toes. And this is graded 70 to 90 degrees. We're going to do extension, which is moving backwards. And that one would be graded 30 degrees. The next one is lateral, which would be graded 35 degrees. You can do it bilaterally. And then the last one is rotation, leaving your hips forward, and that one should be noted at 30 degrees. Now just one more test that we're going to complete is the Romberg sign. I'm going to ask you to keep your feet together facing forward and shutting your eyes, and we will do this for 20 seconds, and we're just looking for his stability right here. He seems to have passed this test. Okay, I would like to thank you so much for watching my video, and I hope you have an amazing day.